Hello and welcome everyone to this edition of the Hindus Wellness Series presented by Kauvery Hospital. The topic for this webinar is Love Your Liver. We are going to know as many things as possible in the next 1.5 hours about how to care for our liver from three senior doctors who are joining us today. Let me take the pleasure of introducing the panel to all our viewers. We have with us Dr. T.S. Chandrasekhar, who is the chairman and chief gastroenterologist and liver specialist of MedIndia Hospitals in Chennai. He's a veteran with more than 3 decades of practice, particularly dealing with liver-related ailments. He's a Padma Shri awardee. He has served as the president of Indian Society of Gastroenterology and also the recipient of the prestigious Master of World Gastroenterology Organization Award. We are really honored to have you today with us, Doctor. Welcome.
Thank you. Am I audible and seen there?
Yes, doctor, you are very much audible and seen. Yeah.
So I have very great pleasure in participating in this webinar.
Yes, doctor.
Organized by the prestigious Hindu magazine, Wellness Series.
Yeah.
I like the word Wellness Series. It is not like about the disease and to scare the people.
Yeah.
I must congratulate the Kauvery Hospital, Chennai, and doing this wonderful job in collaboration with the Hindu.
Thank you, doctor.
Thank you for your kind introduction.
Thank you, doctor.
Now,
I'll introduce the other panel members also, doctor,
please,
and then I'll come over to you. Thank you, doctor.
Okay, right.
We also have with us Dr. Ilankumaran, who is a senior consultant, liver transplantation and hepatobiliary surgery, and also the head of liver diseases and transplantation center at Kauvery Hospitals. He completed his undergraduation and post-graduation from Madras Medical College. He did his super specialization from AIIMS, and he has studied abroad as well, and he's a specialist in living donor liver transplantation in both adults and children, and he brings with him an experience of more than 1,200 liver transplantations. It's really a pleasure to have you with us today, doctor. Welcome to this discussion. We also have with us Dr. Murli Jayaraman, who is a consultant surgical gastroenterologist and advanced laparoscopic surgeon at Kauvery Hospital. He did his undergraduation in Madurai Medical College. Later, he went on to do his PG in Stanley, and later he did his super specialty in Amrita Institute of Medical Sciences. He has had a distinguished career right from his college, where he won a gold medal in general surgery during his UG and also a gold medal in pediatric surgery during his PG course. He has delivered a number of lectures and published many papers in several national and international conferences. We are happy to have you, doctor. Welcome to this discussion. To the viewers who are joining in for this discussion, the format is going to be that all the three panel members will make a short presentation initially, and that will be followed by a panel discussion. And then we will also be taking as many questions as possible from the viewers. Dr. Chandrasekhar, over to you.
Thank you. Thank you very much for the nice introduction. And let me build a story why one should love his liver and why he should love others' liver, in the sense how you can take care of others' liver by donating also. So it is not the love your liver alone, love the liver. Okay. And this is a very interesting concept, love your liver. I bring warm greetings from our institution, MedIndia Hospital, Chennai. The question for the public would like to know, you have so many organs in the body. What is the great thing about the liver? Why should one love the liver? Okay. So the scope of this lecture to explain why one should love the liver is anatomical uniqueness, liver functions, diseases affecting liver, how we really make the diagnosis of these liver diseases. What is the overview of the treatment you doctors, you may ask us, or we doctors, how we treat this, how we prognose, how do you assess the prognosis of these liver diseases, And above all, the public will be keen to know how we can prevent liver diseases. So this is a nutshell will tell you about one should you love the liver. This diagram will tell you the liver is situated below the chest in the upper part of the tummy, what we call it as abdomen. I was told this lecture is for only public, so I'll make it as simple as possible without using the medical jargons. You just see the liver here. It secretes the bile. It comes in the bile duct and joins the intestine. It is in close association with the pancreas. And there is another important thing is the gallbladder joins the bile duct and is a storage organ for the bile. What is the specialty of the liver? Every organ has got one blood supply. Like this organ also has got a blood supply to survive. This is hepatic artery. The another specialty is whatever you eat, the nutrients in the stomach, in the intestine, you go through this another vessel called a portal and reaches the liver. It itself will tell you that how important the liver is, because whatever you have digested, whatever you have absorbed, it goes to the liver for further processing. It is just to tell you that the advances happened in this field. You can know every bit of small liver, what are the things they are functioning like this. It's just to show you the cross section of the liver. I will not go into the detail. So to sum up here about the uniqueness of liver is, it is weighing 1.5 kilograms and it secretes bile. It's the largest exocrine gland in the body. The peculiarity, to give more importance, it has got dual blood supply. One thing is so important. You may think hair and nail, but much more than that, functional organ which can grow throughout the life if part of it is resected. Very important. And the entire intake of nutrients from our alimentary tract. You want to survive today, you must have your liver. You want to fast for a few hours, you must have the liver, because the nutrients from alimentary tract reaches the liver for further processing. I would not hesitate to call the liver is a chemical factory and godown of our body. It stores and processes it, so factory and the godown. This is a diagrammatic representation. I just want to ask, but by the time the question has already come in, how many functions liver does? You know, kidney does few function, heart does one or two function, brain does very important processing like that. But it's a one organ in the body which it does more than 500 vital functions. That means you cannot emulate liver. Without liver, you cannot live. That's the reason why we tell love the liver. So briefly, I'll touch upon what are the functions we do. The liver does. It produces the bile, is a digestive juice which breaks down the fat. Don't you think you eat so much on what you have seen in the right side of the slide, you want to digest, bile is important. And the proteins, very important. And the cholesterol and the production of special proteins to help carry fat throughout the body. So it has to take the fat throughout the body, so it has to produce cholesterol. And very important is whatever excess glucose is converted to glycogen for storage. And whenever we need glucose, this is like a major depot. Whenever we in short of glucose, it supplies glucose from the liver to the bloodstream. So that's the reason why we can tolerate hunger and also fasting for a few hours. Otherwise, nobody can fast. Every time you have to keep on eating. Can you imagine this scenario? You're always 24 hours eating to maintain your life, which is not possible. And it produces amino acids. Amino acids, the building blocks of the very important thing in our body. And this is another important thing is it processes the hemoglobin, which is the byproduct or end product or toxic product sometimes from the, and processing of the hemoglobin is very important. Say iron has to be converted into hemoglobin. And people say my hemoglobin is very low and I'm anemic. That may be one of the reasons will be the liver is at fault. And another important, it is this cleaning process. Nowadays, it's so important about cleaning, and it converts ammonia, all the toxics. You take some drugs or poison or anything, and it get detoxification. So liver is such an important organ. So this is just to highlight only I'm telling, and a certain blood, clearing the blood of drugs and other poisonous substances. This is called a detoxification mechanism, and regulate the blood clotting. You will not be able to survive without liver. The reason is if you have a cut injury here, start bleeding so profusely, but liver synthesis some proteins for with which you can be able to seal off this bleeding. This is a very important thing. And liver is a bacterial filter. Just to see if you have a filter, all the organisms will be filtered in the liver, and it produces immune response also. So without which you will not be able to survive against the bacteria. So very important is. Now bilirubin will be converted. Clearance of bilirubin is a byproduct, a toxic product from the process. I will not go into detail. If you accumulate bilirubin, what will happen? Jaundice will appear. So one thing I want to make it clear here is public to know is jaundice is the result of the liver dysfunction. If your liver is at fault, you will develop jaundice. So very important thing. Now you will be wondering, sir, 500 over functions, dual blood supply. It has got a great anatomy, great physiology, functions. Then why we damage the liver? This is what exactly the webinar is for. If you don't damage the liver, will live forever till you are alive. Then why do we damage? Sad to tell you here is the important cause of liver damage is the alcohol. So you are touching the very sensitive area. How now people taking alcohol has become a common thing. No, they don't know that. What is the second important? Also alcohol. So important. Third important reason also alcohol. Every day in my hospital, I see not less than 4 or 5 patients who have been admitted or who comes for outpatient consultation because of alcohol related injury of the liver. And the other thing is the viral hepatitis A and E may be the reason for the viral hepatitis A and E may be due to the contaminated water or the food contaminated. So that usually they are self-limiting. But the most dangerous will be, which I will show you a video clipping at the end of my talk, and B, C, and D. You are telling like the UKG students or LKG, all the alphabet. Yes, this has been diagnosed to have so many viruses, A, B, C, D, E. And the whole important thing I want to tell you here is, we think the baby is very fat, or the plumpy, and the common man is having some kind of prosperity in the form of obesity. We always think it is safe. But no, obesity, that is overweight, is the most important cause of liver disease. After alcohol, I will tell you. Now, it may even supersede alcohol also. And bacterial infection like typhoid and malaria, which we'll be able to eradicate once you get it, but we try to avoid that. Cancer of the liver can also appear, one of the reasons for the defect in the liver diseases. Causing liver diseases. And adjacent organs also can produce liver diseases like gallbladder and bile duct stone, cancer. I told you about it. Now we are very clear. Just look at the slides. All these causes are preventable. You can live happily with a lovely liver if you do not indulge in certain things, which I am going to tell you about that. So you should not only know how to love the liver, why to love the liver, how you have to function the lovely liver. Let's take about alcohol and liver. It all depends on the type of alcohol you take. No alcohol is safe, but the whiskey and brandy may be more dangerous. And duration of intake. Sir, I have taken only once will I get liver disease. It is scientifically proven those who have taken continuously for more than 5 years definitely will get the liver disease. But in the moderate quantity, if you take it for a small duration also, there can be damage to the liver. It will be which are further accentuated with the obesity and chronic viral hepatitis, and genetic factors will add on to that. Oh, sir, I have taken alcohol. I'm feeling little guilty. Can you suggest something? Yes, there are two stages, reversible, and doctors will be able to find out. You stop alcohol, you become normal. Unfortunately, people come with the irreversible damage. Nothing can be done, but there also some salvage can be done if you abstain from alcohol. So abstinence is the only solution for alcohol liver disease. I'm going to touch upon very important. Mr. Ponvasandan and the Hindu again group also told me, sir, we want to know more about the obesity. This is going to be the problem of not only the future, current, even the children are obese, adults are obese, women are obese, so much a problem. And obesity freely invites all these diseases. One of them is the liver diseases. Yes, how does it do that? I will not go into so much detail, only the doctor should know that. But public, I can tell you that 2 times it hit. And then if you have excess body weight, if you eat indulge in a lot of fat, or you have some fat metabolism defect, it gets accumulated in the liver. Suppose in your house you accumulate something enormously, what will happen? There can be damage to that house also. Like that it happens. Such a lovely liver getting damaged because of the extra accumulation of the fat, which can come out of the liver by rupturing the hepatocytes. You will not feel all these things. So, doctor, I don't feel any rupture and all. It's all happening microscopic level. And it produces oxidative stress and lipid peroxidation. I will not tell you all these things detailed. The reason I want to tell you here, show it in this slide is enough and more scientific work has been done to prove that obesity causes definitely liver disease. This is just a diagrammatic representation to convince you, to tell you the science has advanced so much and there is no doubt about the liver damage because of the obesity. You will further will not be convinced. Still, I show this slide. And the left extreme, you see the healthy liver, such a nice, good-looking, smooth liver. And over a period of time, reversible, irreversible, and such ugly-looking, shabby-looking liver with a lot of projection, and sometimes cancer also. Doctor, don't scare me. Cancer, how can it come? I always believe that if you are little plumpy and you are overweight, you are always healthy. We always appreciate babies being like really fatty or they look good and all. No. So this is a very important message I want to convey to you. Is what do you do, Dr. Suppose my cousin brother has got overweight and he is weighing around 95 kilos. So I will find out the ideal body weight. He should weigh only 75 kilos. He is having 20 kilos extra. I will rule out other liver disease the causes, and I will promote weight reduction, promote daily physical exercise. That's the only treatment. There are certain drugs. This is not the scope of the lecture here. And but most important, sometimes, sir, you may ask me, sir, my sister is over, he is weighing around more than 100. I don't think any excess is possible. Any drug also he's tried. And what else you do this? Then we have to go for invasive treatment. I just tell you, I will not go into the details. There are treatment available. You can put a balloon into the stomach. And it's just to show you a video how the balloon can be placed for 6 months to 1 year. You can reduce 10 to 12 kilos. But mind that if you once you have to remove the balloon after a year, again they may put on weight if they are not careful enough. And there are other techniques are also available. To reduce the size of the stomach, we have an endoscopic technique called gastroplasty. Again, I am not here to tell you the technical details, but to tell you that how the stomach can be shrunk with this endoscopic technique called gastroplasty, endoscopic sleeve gastroplasty. And you may ask this question, moderate obesity, all right, but if you have a very severe obesity, then you reduce the weight with this endoscopic technique, then you go for the surgical bypass. Do you want to undergo all these things? The best is prevent obesity. And very simple, do this exercise. You'll be wondering, what is this exercise is telling? You just turn your head left to right. How can it reduce obesity? You must do it when the food is served to you. You say no to the food and you eat what is very essential and what is necessary for you. So having said about alcohol, you told me about prevention and about the obesity also. How can we prevent it? Hepatitis B virus. This is such a complicated virus. The discoverer got the Nobel Prize, and it is a very enigmatic virus, and it can get integrated into the liver. And this just to tell you that science has advanced so much. If 100 people are affected, 5% will go into the chronic liver disease and cirrhosis. Again, B virus spreads like a AIDS, that is the blood contamination, needle prick, I'll tell you. So this is the about the B virus. And like that, we have C virus. A and E less dangerous and nothing to worry, self-limiting. C virus, the discoverer of these C viruses, last year got the Nobel Prize. That means they took so much of time to discover this because millions of people have been affected by the C virus disease, very important. And this is just tell you that, again, it takes 20 to 30 years. You may ask me, suppose if I do the master checkup here itself, we could have prevented. Yes, that is the answer now. And treatment of chronic hepatitis, what we call it, antiviral therapy. The message here is hepatitis C virus is 95% over that curable and 80% of the B virus treatable. But advanced stage, you have to refer it to our colleague Ellen Tumor, and that for the liver transplantation or some other complication to Dr. Murali. So we want to do this. How does it present? Acute or chronic? Acute means short lasting, chronic means more than 6 months, loss of hunger, fever, tiredness, body ache, muscle pain, yellow colored urine, jaundice, eyes, and vague upper tummy pain, and prolonged bleeding in the severe failure, altered sensorium, and coma, liver swelling. So you told me so much in one go. Yeah, these are the symptoms of acute liver disease. In chronic liver disease, apart from jaundice, you have anemia. Both legs are swollen, muscles are getting wasted, tummy is getting bloated, and poetically they explain that poverty above and plenty below, and blood vomiting can be a very, very dangerous thing. And I end up with the liver cancer and death. This is the what. It's just not to scare you to the public. I didn't want to show that, but if I don't show that, I will not have, my lecture will not have impact, tummy bloating and the leg swelling, and this is the jaundice, and this is how the blood vomiting appears here, bleeding. And now, doctor, I'm convinced that I should love my liver. You told me so much of function, anatomy. How you doctors diagnose it? We go to the thorough history and clinical evaluation, blood test, liver function test, viral markers, tumor markers, and we image with ultrasound, CT scan, MRI, PET scan, nuclear scan. Do you do all this investigation in one patient? No. Whatever needed, whenever needed, whomever need, only we do this, and we can assess prognostic also. Doctor, I am convinced now you people diagnose very well. What are the complications? Complication, fluid accumulation, malnutrition, sepsis. Because I told you liver is a bacterial filter. If it doesn't get filtered, it's sepsis. What do you mean by sepsis? Bacteria in the blood is sepsis. And worsening of the jaundice, blood vomiting, prolonged bleeding. If you cut the wound, from the cut wound, you'll have the bleeding, coagulopathy, altered sensorium, liver cancer. Doctor, little scaring me. Then overall, how will you treat the liver? Yes, we identify the reason for the liver disease. Identify the stage of the liver disease. Early or advanced, mild or severe, presence of complication. Abstinence of alcohol is the most important. Reduce body weight and daily exercise, supportive treatment, vitamin, mineral, electrolytes. Then we go into the specific therapy like bariatric, obesity treatment, viral treatment, endotherapy, that is endoscopy treatment, like ERCP for bile duct stone stitcher, diet modification, treatment for complications, and liver transplantation, if it is acute liver support, all these things there in the armamentarium. We have so much in there and our kitty that will be able to prevent, and preventive aspects also will be able to tell you that. So the $1 million question everyone will ask you, the common thing, how do you, what diet you take? I tell you 4 Ds are very important for liver. Drugs, diet, follow the doctor, then destiny also plays a role, in the sense I'm not discouraging destiny, in the sense those who don't follow the diet and drugs and doctor, then they fall into the bad thing in the destiny. Low fat, high protein diet, we have adequate calories, salt restricted diet, vitamins need to be supplemented, K, A, D, E, K, and B complex vitamin either through diet or medication, oral fluid restriction, high fiber diet to avoid constipation. What are the invasive treatment modalities? If you have a bloodworm, those days we used to operate. Mortality and morbidity used to be very high. Nowadays we have endoscopy treatment. We do the banding and control the bleeding. And what a fantastic, we have saved millions of people in this. This is just to show you endoscopy treatment. We need minor sedation, no general anesthesia. Patient is safe, and this is how we control the bleeding. And what about this? These are the stent we can produce. Stent is artificial bypass, artificial product which we can just place it in the bleeding area and we will be able to be stented. This is how fantastic treatment. Science has advanced not only in the diagnostic aspect, not only assessing the prognosis. Prognosis means what is the future of the disease. And when you have excess fluid collection, you can do the tapping of the ascitic fluid now. And what is ERCP? You have told twice, endoscopy retrograde cholangiopancreatograph. You see, the ERCP is to remove the stone so that cholangitis, so the liver abscess can be prevented or avoided or can be treated. This is how through the endoscopy we go into the bile duct, and through the bile duct and we remove the stone. We cut up a little more in that area. This is highly technical subject. I just want to show you that victoriously we have come out with the stone removal. We have done thousands of cases like that. This is how the liver-related diseases also. See, the stone has been brought out now. So this is about it. Now, ICU, there's a dedicated ICU for liver diseases. And for acute liver support, we have a Mars. This is something akin, not totally like dialysis for kidney, dialysis for the liver. Finally, my colleagues, they tell you that liver transplant is the treatment at a stage of the disease without which the patient cannot survive. And this is just to show you that my colleague will describe in detail. How will you assess the prognosis? I want to tell you be positive. The liver disease is salvageable at any stage of the illness. And don't believe that there is no treatment in the English literature, the allopathy. No, for every stage of the disease we have treatment. The key is the early detection. Liver transplant at an appropriate stage is recommended. And acute severe hepatitis can have a bad prognosis. I had a patient who had down in 3 days with the liver disease. He was progressing very bad, and we could save the patient with the liver transplantation. And go for the screening and vaccination. There are definite vaccines available for A and B, which you can prevent. If you vaccinate yourself against B, you can prevent liver diseases, you can prevent liver cancer. Finally, no alcohol to prevent the liver disease. If you love your liver, this is very important. Take potable water, hygienic food, avoids A and E viruses. Avoid the unprotected sex and contaminated needle prick and unscreened blood transfusion. This is the totally a medical practice concern. I just want to tell you that avoid fat-rich foodstuff, promote daily exercise, maintain daily body weight, and vaccinate against A and B, screening for hepatitis viruses. And very important, my colleague, I remember, my friend, he had not undergone master checkup. He comes to me with hepatitis C virus, which could have been detected very easily. Hardly it costs anything and would have been done with a blood test. There's a short presentation for the
Is there
public.
anything more dangerous than AIDS? Yes, hepatitis B and C viruses, the silent deadly killer viruses. The short film on hepatitis B and C related liver diseases has been conceptualized and released by Dr. T.S. Chandrasekhar and his team in the interest of public awareness. For more details, please visit www.drtschandrasekhar.com.
Millions, why billions of microorganisms invisible to the human eyes or swarming in the environment around us eternally. Some of these organisms infect and endanger the mankind. Hepatitis B and C viruses come under this category. You know how, like the white ants eat into the wooden structures without any overt evidence, these viruses enter into the liver, multiply, and damage the entire liver without causing any significant symptoms before the disease is diagnosed. Liver is the chemical factory of our body that performs over several hundreds of functions round the clock. Hepatitis B and C viruses damage healthy liver permanently, resulting in an irreparable shrunken liver called cirrhosis of liver, and in few cases may lead to life-threatening liver cancer too. Several million Indians are suffering from these hepatitis B and C related liver diseases. This is a great public health concern for India. Unfortunately, in the beginning, the patient does not appreciate any symptoms, hence delaying the early diagnosis. But in the advanced stage, the patient presents with a paleness, bloating of tummy, swollen legs, and jaundice as a result of progressing liver failure. Luckily, nowadays, accurate early diagnosis of hepatitis B and C is possible with a blood test, scan, and endoscopy. With available highly effective and over 80% of hepatitis B infections are treatable. But in the advanced stage, cure is not possible. Hepatitis B and C are bloodborne infections and disseminate like AIDS virus. Currently, B virus is totally preventable with the 3 doses of vaccine. Unfortunately, there is no preventive vaccine against C virus is available as on today. But there are certain preventive measures like screening of these viruses before blood transfusion, avoiding unprotected sex, and not sharing needles with infected persons and drug addicts, inclusive master health checkup, and vaccinating newborn and healthcare personnel against B virus. These preventive measures need to be promoted in our society to eradicate these viruses. So I think with this, I just want to tell you, tell you the whole aim of this wellness series done by being organized by Hindu magazine is to create an awareness among the public. I once again thank the Hindu group and the Kauvery Hospital for giving this opportunity. Those who want to see the lectures, they can write to us, medindialectures@gmail.com. I can share the slides with them. If you have any question, we'll take up. If the time does not permit, you can send it to the email also. Thank you very much for this wonderful opportunity.
Thank you. Thank you so much, Doctor. It was an excellent introduction, and you gave a very broad overview in a language that is understandable to common public as well. Thank you for that. Now, may I invite Dr. Murli Jayaraman to make his presentation?
Good evening, one and all. First of all, I would like to thank the Hindu organization for giving me an opportunity to be part of this wellness series and deliver my lecture on the role of surgeon in liver diseases. Karthik, share the slides. Dr. Chandrasekhar gave a beautiful overview of the liver diseases, starting with the function of the liver, the structure of the liver, and things like that. And I think he made my job much simpler. So in the next 10 or 12 minutes, I'll be going through few aspects of liver disease where the surgeon has got a definite role to play. That means the liver tumors and things like that. I'll also touch upon conditions like portal hypertension, wherein a surgeon will come into picture. The main focus behind my topic will be to drive on the fact that liver surgery is a very complex surgery. It has to be done by expertise and it requires a lot of skills. But at the same time, it has now become very safe surgery, and it can be, means provided proper facilities are there, it can be done even in tier 2 or tier 3 cities. So liver, when do a surgeon come into picture in liver diseases? Mainly for resecting or for removing a tumor or any such lesion in the liver. So this tumor can be either a benign or an ordinary tumor, or it can be a cancerous tumor, or it can also be for sometimes for a non-tumorous condition like a huge cyst, what we call as a cyst, or even in liver trauma, sometimes we may have to perform liver resections. Then we also do surgeries, as I told, shunt surgeries for portal hypertension. This portal hypertension, Dr. Chandrasekhar told means in his lecture about the pressure in the portal or the blood supply to the liver getting built up, causing portal hypertension, causing blood vomiting and things like that. We have a definite role to play in that group as well. And finally, we'll also have to do complex bile duct surgeries, like for conditions like bile duct strictures or bile duct cancers. So these are the areas where we'll pitching. So just a brief overview about primary liver cancer. There are two categories. One is a hepatocellular cancer and the other one is a cholangiocarcinoma. I'll be basically dealing with hepatocellular cancer. HCC is the fourth leading cause of cancer worldwide, cancer death worldwide. In India, the incidence is slightly on the higher side compared to West, but still it's on the lower side compared to Japan, China, and other Southeast Asian countries. If you look at the incidence for 1 lakh population, close to means 3 males are getting affected, and close to 1 female is getting affected for 1 lakh population. Generally, it peaks in 7th decade, but it can occur in younger age group as well. And what is the main reason for this liver cancer? Mainly about 30 to 80% of situations, it is the background cirrhosis, which Dr. Chandrasekhar was alluding to in previous lecture. And the next common cause of liver cancer is hepatitis B virus and hepatitis C virus. In fact, hepatitis B virus is endemic in India. It is more prevalent in India. And if you look at it carefully, more than 50% of patients who are diagnosed to have hepatocellular cancer or HCC, they are hepatitis B positive. The next most important cause, which is coming up now, is obesity, diabetes, and metabolic syndrome, which will lead on to a condition called as a non-alcoholic steatohepatitis. That is a fatty liver. That is commonly called as a fatty liver. And it's an important risk factor for cirrhosis as well as hepatocellular carcinoma. And India being a diabetic capital, I think we are seeing more of these conditions on the rise. Definitely, alcohol is one of the important cause of cirrhosis. Just because Dr. TSC was mentioning about alcohol, I just didn't mention it here. That doesn't mean alcohol will not affect. Alcohol causes cirrhosis, and with the cirrhosis background, it can lead on to hepatocellular carcinoma. And most of these patients, they present in advanced stage in India even now. So either it can be because of the late stage of cirrhosis, or it can be because the tumor has already advanced. Nevertheless, we can pick up early tumors by doing routine screening. The routine screening is definitely recommended for patients with hepatitis B virus carriers or patients with cirrhosis to pick up hepatocellular carcinoma at much early stage. We recommend every 6 monthly screening, ultrasound screening for these patients. And there are other diagnostic modalities like CT, MR, PET scan, etc. for diagnosing and staging the liver cancer. And how to treat these liver cancers? Means always the intent will be to go for a curative treatment. In a non-cirrhotic patient, where the liver is good, we can do a liver resection. We can resect that part of the tumor, means the liver which is having the tumor. And generally, those patients will have a very uneventful recovery. Similarly, in patients with compensated cirrhosis, where their function is still okay, there also we can remove small tumors. But generally, for patients with full-blown cirrhosis and cancer, liver transplantation is only respite, which Dr. Ilan will be addressing in a subsequent lecture. Then there are other modalities like radiofrequency ablation and other chemotherapy modalities, which I will not be dealing with in much detail. Then we have something called as metastatic liver tumor. What do I mean by metastatic tumor? The primary cancer is somewhere outside in a different organ, and the cancer has spread to the liver. In a common parlance, we call this as an advanced tumor, means we call it a stage 4 tumor. But not all stage 4 tumors which are spread to liver have got dismal prognosis. This is an important point which I want to drive across today. Not all liver, means metastatic tumors to the liver have got dismal prognosis. There are cancers which are low grade, like and they have good prognosis as well, even if they are spread to liver. One among them is colorectal cancer, means cancer arising from colon and rectum. Even if they are spread to liver, if they are aggressively treated, we can give them a very good prognosis. And to the similarly, for some special cancers like a neuroendocrine cancer or gastrointestinal stromal tumor. So we need to, we cannot brush away all patients with liver metastasis as poor prognosis or cannot be cured, not that category. We can give aggressive surgical treatment in these select group of patients, and we can give them very good results. I would just want to share one such story. She was a 50-year-old female with abdominal pain of 6 months duration. She was evaluated outside and was diagnosed to have advanced cancer in the pelvis with a liver spread. And she was referred to our hospital basically for a symptomatic care or a palliative care. But she was actually, when she came to our hospital, she didn't have many hopes. That's what the people outside have told her apparently. But to our surprise, we found that her labs were within normal limits, and on CT scan, we found a huge tumor in the left lobe of the liver, and there was another tumor in the colon, very close to the colon, actually, the CT imaging wise. But the appearance of the tumor in CT gave us a hope. It looked like a gastrointestinal stromal tumor with the appearance and the vascularity. So we decided to give her a chance and go ahead with the surgery. We decided to resect the liver as well as the primary tumor in the same single sitting because the patient was otherwise healthy. So this is what we found. We found actually a fleshy growth in the small intestine, not in the colon. We found it in the small intestine, and there was a large tumor in the left lobe of the liver. So this is a tumor. You all can see the tumor in the small intestine being resected, and then we proceeded with the liver resection as well. See, there's such a huge tumor in the left lobe of the liver, and we are proceeding with the liver resection. We are just looping the vessels, and we are dividing the liver, and that's a final stage. And the tumor is out, and the rest of the liver is looking pink and healthy. And this is the specimen. Such a huge tumor being removed. Patient was discharged on the 6th post-op day. In fact, it was a biopsy report came as a gastrointestinal stromal tumor. Patient further took targeted chemotherapy for 2 years, and now she is doing fine even after 4 years of surgery. She is under regular follow-up. So this is just a scenario, just to point out the fact that not all tumors which are spread to the liver have poor prognosis. We can give them a very good treatment if proper case selection is done and if aggressive treatment is done. What are the challenges we face in liver surgery? The main challenge is the complex anatomy and function, which Dr. Chandrasekhar was telling previously. The risk of blood loss, because the liver is richly supplied with blood, it has got a dual blood supply. So when we cut the liver, the risk of blood loss, that was a very perilous thing in the past. And obviously the risk of liver failure. I'll address the third risk first. Liver has got a fantastic capacity to regenerate. I think Dr. Ilan also will be addressing this definitely in transplant, but I just want to tell that liver regenerates. This is a Greek mythology. Most of us may know this. This is a Prometheus mythology, wherein this guy's liver was made to bite by an eagle, and it kept on regenerating. So liver has got a fantastic regenerating capacity. and that can be made use of while resecting the liver. So if the rest of the liver is normal and it's got a good function, it will regenerate very fast. So the next the fear is, the dread is a blood loss. Previously we used to do surgeries with we used to transect the liver with forceps and fingers, so these are leading on to more blood loss. But now we have gadgets like ultrasonic dissector, then we have gadgets like water jet or dissecting sealer, and then other energy instruments with which the blood loss can be minimized to a large extent. And we have done many liver resections without even transfusing a single unit of blood. So that is the advantage of having all these gadgets to take care of the bleeding. And then finally, definitely we cannot this one, the role of undermine the role of the ICU backup and the role of intensivist and anesthetist in managing the liver surgeries. As I told, it's a still a complex surgery, leaves a lot of skill and expertise, but definitely it's a safe surgery. Just will tell another story. Is a 20-year-old male who came with bloody diarrhea, recurrent episodes of bloody diarrhea and abdominal pain. He had few episodes of blood vomiting as well, and he was treated in multiple hospitals. When he came, he was with severe anemia and very low platelets. These platelets are very important for clotting of the blood, so he had very low platelets. So when his ultrasound was done, it showed blocked portal veins. The portal vein, as is seen in the diagram, it supplies the blood from the intestines to the liver, so that the main portal vein gets blocked. So when the national highway gets blocked, we have all the traffic going through the alternate channels. So that's how it happens. There will be a lot of alternate channels of blood vessels opening up, leading on to pressure in those channels and bleeding. So that was happening to this patient constantly. You see the endoscopy picture, a lot of such alternate channels are opening up with bleeding. So this patient was managed with multiple times. He was managed with banding and sclerotherapy and endoscopic procedures, but he still continued to have bleeding for two reasons. One, the pressure was high, and the other reason was his platelets were very low. So we decided to proceed with surgery, which is called as a shunt surgery. Again, it's a major surgery wherein we remove the spleen, which is enlarged because of this portal hypertension, and we shunt the vein, the splenic vein to the vein of the kidney, left kidney. So as you can see in this diagram, we shunted. So he was taken up for surgery. In this diagram, you can see the spleen being removed and the shunt being done. So he had again a fantastic recovery, and 5 years down the line, patient is doing fine. His repeat endoscopy showed regression of the varix. There is no bleeding, and platelet counts are normal, and is getting married soon. That's a good thing about it. So as far as liver surgery is concerned, it's the most complex GI surgery procedure. Definitely requires skill and expertise, and definitely good electronic gadgets to take care of the bleeding. But it is definitely a team effort from the surgeon, anesthesiologist, intensivists, and ICU nurses. We also cannot undermine the importance of supportive services like blood bank, advanced imaging, and lab services. Having said that, it is still a safe surgery, and with all these backups, we can do a very good liver surgery. And if these things are available in a tier 2 city or tier 3 city like what we have, we can definitely, we are doing good liver resections in this part also. Just to touch upon acute liver failure, because the next topic is going to be dealt with by Dr. Ilan regarding transplantation, I thought it was important. And not only that, this acute liver failure due to rat killer poison, though it is not a surgical topic, and I just want to take few more minutes to address this topic, because this is one such common problem, and the people affected are young people, young boys and girls who have committed, who do this mistake out of frustration and out of despair, and they end up with a great problem. So I just want to address this rat killer poison, just 3 slides. It is first of all easily available. This rat killer poison is very easily available in India, and it's cheap. It contains 3% yellow phosphorus. This is a deadly poison. It's slowly released from the stomach and intestine, and it affects the liver in the next 3 days. predominantly liver. It can also affect other organs, but it predominantly affects the liver, and the liver cells completely damages and the liver goes in for a failure. Most, as I told, most of these are suicidal. In the spur of moment, the frustration and despair, the youngsters, they swallow it and they come up with a liver failure. But there is no looking back actually, because the mortality is huge. Once the liver fails, the mortality is 75%, and there is no antidote. Till date, there is no antidote for it. And till date, the only hope was liver transplantation. The liver fails, the only hope was liver transplantation. But then something came for our respite. The studies started coming regarding the role of therapeutic plasma exchange. Therapeutic plasma exchange, where it's a type of a dialysis which can be done to remove these toxins and save these patients from death as well as from liver transplantation. So we also tried this in few patients, and we, to our surprise, we got good results. Just another story: a 24-year-old MBA graduate. He came after consuming some 30 grams of yellow phosphorus. Luckily, he came quickly to the hospital, and all the preliminary things were given. In the first 24 hours, his liver function was normal, but we did not wait. We started him on therapeutic plasma exchange. As I told, it is a type of a dialysis wherein the toxins are removed from the body. We gave him 5 cycles of therapeutic plasma exchange, and after that, his liver function stabilized, and he did not go in for a liver failure. We could salvage him from ending up with a liver failure, and he was discharged on 8th day. And 1 month down the line, he came to our OPD. He's doing fine, no jaundice, and perfectly normal. So rat killer poison is such a common thing in our country. We can save lives by early plasma exchange. But obviously, when the patient presents late, liver transplantation is the only hope. With this, I would like to conclude my presentation and be happy to answer any questions. Thank you.
Thank you, Dr. Murli. Thank you for telling us about the surgical procedures that are available for liver-related ailments, particularly in Tier 2 and Tier 3 cities as well these days. Thank you. Over to you, Dr. Ilankumaran.
Hi. Hello, Mr. Vasant. Thank you for sharing now. And it's a great pleasure and privilege as an avid reader and subscriber to Hindu for the past 35 years. It gives me a sense of privilege to be speaking on the same podium along with others in the Hindu network. So today we've been here to talk on the wellness series. You know, I recently read this quote saying, when I goes and we comes, so illness goes out and wellness comes in. So it is definitely a part of our responsibility, each and every one of us, to spread around the message of wellness. And doctors are always there to spread positivity and the message of wellness rather than just to help you at the moment of illness. So this concept of about liver as a organ which is so important for wellness is being realized more and more. And I would like to share my presentation now. So, sorry. I hope. Yeah. So there it goes. So love your liver is such an important concept, and because liver being the seat of life, you know, it got the name liver because it was considered to be the seat of life. And this knowledge does not come from very recently, but then from years ago. This is a very favorite legend of mine where the picture shows Prometheus, a Greek titan. 3,000 years ago he lived, and he brought fire from the god Zeus to the humankind. And he was punished for this act of treason by being chained in the mountain of Caucasus, and his liver was being fed to an eagle every day. And it is so interesting as a liver specialist for me that people knew that liver would grow. So the story goes like this, that the eagle would come every day, eat a portion of the liver, come back the next day to find out that the liver has grown back. So it puzzles me to know that people who lived so many years ago understood that liver has this amazing capacity to regenerate. And I rightly find that even like we discussed, the name liver comes from the seat of life. You take any language, we say jigar in liver, you will call jane jigar. I mean, you say Tamil also, Eram. In the Eral comes Kalliral. So almost everyone realizes the importance of liver, and rightly so. We need to focus on liver health to lead a very happy and healthy life. So we've listened to Dr. Chandrasekhar, Padma Shri Awardee. He's speaking so elaborately and so well about liver health and all the functions and what diseases. And I also thought that I can, capture these in a nutshell rather than going into technical details directly. Like he has explained very correctly that liver has numerous functions, but basically the functions can be classified as synthetic or productive, where it produces mainly proteins, which are the building blocks of the body, and several other important metabolites, and it stores as a very important godown, where we store energy in the form of glycogen. We store vitamins and minerals, which are very essential for our day-to-day functions. And more importantly, it also is a policeman. It does the detoxification function. Anything you eat, drink, be it alcohol, food, medicine, poison, everything goes through the liver, gets circulated and detoxified. So these are the three important functions. Why I need to understand is because when liver fails, the main symptoms are related to this. When liver factory fails, the synthesis comes down, the protein is produced less, so the body becomes weak. All the important functions like immunity, blood clotting, everything becomes weak because of the loss of proteins. Because there are lack of stores of energy and vitamins and minerals, you're not able to carry on your normal activities. The earliest symptom of liver failure is weakness, tiredness. The body is not able to get the energy continuously because there are no energy stores in the liver. And detoxification, if it fails, the person starts from being mildly drowsy to even a stage of comatoseness, and all these are symptoms of liver failure based on inefficient functioning of the liver. And like we said, there are several diseases of the liver. The common diseases are the infections, which may be a recent onset or a long drawn infections, or cirrhotic liver disease, which is the liver cirrhosis, is the liver damage and fibrosis. It is a completely scarred dysfunctional liver. Based on the grades of dysfunction, if it is within acceptable limits and the patient does not manifest any symptoms, they are called compensated cirrhosis. And if the patient starts manifesting symptoms like we said, jaundice, fluid in the belly, blood vomiting, kidney dysfunction, they are all decompensated. Yes, liver disease can affect very small children because of genetic reasons, because of developmental reasons, and last but not the least, fatty liver, the scourge of the century. It is rising so heavily that even people who are lean are become diagnosed with fatty liver. Children are diagnosed with fatty liver, and gone are the days when you would presume that only fatty people would develop fatty liver. And like pointed out by Dr. Murli, liver tumors are increasing incidence, and like rightly pointed out, it is one of the top 3 causes of cancer-related death across the world and also in our own country. So first, we should all think about, whenever we think about liver disease, we think about alcoholism. We can see that alcoholism has risen more as a part of a lifestyle activity rather than as anything else. This picture shows the crowd that gathered and accumulated just after the break of COVID. And you all have to realize that along with buying alcohol, there is no option of buying a new liver. And a damaged liver because of alcohol is finally going to fail and is severely life-threatening. And the World Health Organization in 2009 came out with the conclusion that out of the major causes of disease in the world, the global disease burden, the 3 main causes are malnutrition, unsafe sex, and alcohol abuse. It is not because of AIDS, it is not because of any other infectious disease of the body. It is malnutrition, unsafe sex. Both are social reasons, and also alcohol abuse. So alcoholism becomes a problem only when it starts becoming a problem drinking and addiction. You need to differentiate between problem drinking and addiction. Addiction is when a person cannot live without alcohol. But problem drinking, people fail to identify at this stage. We normally, as a liver specialist, we ask 4 questions to the patient. We call it the Cage Questionnaire. C, for if you feel yourself that there is a need for cut down in your drinking. C, for cut down on your drinking limits. And A, annoyed by criticism. If people start criticizing you and it's very annoying to you. And G, guilty. You yourself feel guilty that you're drinking too much. And E for eye opener. You need a early morning drink, or you starting to look for a drink whenever you have an opportunity. If the answer is yes to any one of these 4 questions, you've gone into problem drinking, and it is at that stage you become a very high risk for liver diseases. And definitely, yes, the alcohol consumption increased more than 50% in the last 15, 20 years because of so many reasons, maybe social acceptability, affordability, stress of modern life, and in the youngsters, even the desire to be part of the happening crowd. So alcohol-related deaths, not just because of liver failure, because of severe mental issues and social issues, the death rates have almost doubled, and it's a matter of concern. And if you come to cirrhosis, which is the completely damaged fibrous liver, the top causes are, first is the alcoholic liver disease, and second, like rightly pointed out by Dr. Chandrasekhar, it is about viral hepatitis. People do not realize how serious and how rampant hepatitis B and C are across our country. We go to screening places of software engineers or anywhere, we always find someone being infected with hepatitis B and C. They are completely unaware. They are not detected with these infections if not for the screening test. So these infections lie dormant in so many of them people, but in some of these people, these infections can become active and start damaging the liver, can produce liver failure, can produce liver cancers, and hence the need to get yourself tested against this virus and also get vaccinated against especially hepatitis B is very essential. And in our wellness topic, if there is one message that we need to give, I would definitely say like how we're all talking about vaccination for COVID pandemic now. Everybody needs to be vaccinated for hepatitis B. The children are being vaccinated in their immunization schedule. All adults have to be vaccinated 3 times in your life, 0, 1 month interval and 6 month interval, and it provides a very long and durable protection from this infection. And fatty liver disease, not because of alcohol, non-alcoholic, mainly because of the diseases, especially diabetes and hypertension, and also because of your diet and lifestyle. These play a very important role, and fatty liver disease and progressing to liver cirrhosis has become a more increasing problem, and we definitely need to address it in a very early stage to completely reverse the disease and cure it without becoming into a advanced cirrhosis. And definitely other diseases like autoimmunity, where the person's immunity starts acting against his own liver. Wilson's and hemochromatosis are genetic disorders affecting the liver. And cryptogenic, 5 to 10% patients, we cannot detect any identifiable causes for the liver disease, but then it definitely go on to produce a complete liver damage. And we all know that the biggest reason for us all completely having liver diseases topic is about fatty liver. And the most common reasons are our diet, alcohol, and lack of exercise. These are the most important risk factors for fatty liver, and leaving all of them, stopping your alcohol, turning to a very healthy diet, and taking up active lifestyle with aerobic exercises every day would definitely keep you away from fatty liver. And prevalence of obesity among both men and women are definitely increasing, and it is emerging as a major cause of cirrhosis these days. And if anybody has a coexisting alcohol habit or a viral hepatitis, it results in a very early and severe liver dysfunction. And when they're detected early, you can correct the causative factors and you can completely reverse fatty liver to a normal liver. So this is one graphic image where this liver was retrieved for transplantation, and this was rejected because of the content of liver. You can see it's completely yellow and swollen with rounded edges, and this liver in a few years will definitely progress to a cirrhotic damaged liver. And last but not least, I would also like to say that whatever we eat, drink goes through the liver, and that holds very true, especially also with any drugs that we also need to take. There are certain medicines that can affect your liver, especially very high doses of paracetamol and lipid lowering drugs. And these days we also see youngsters coming with abnormal liver function tests, and when we go into the history, we find that they have been taking dietary supplements, herbal supplements. Some of them are known to be toxic to the liver, and definitely discontinuing them gets their liver back on track. And the secret is to take the right dose at the right time and always take medicines with a prescription. So the protective strategies are to wash your hands You know, there are so many infections, especially hepatitis A and E, which are waterborne infections, can be prevented by having clean hygienic habits. Wash your hands and be careful not to eat unwashed food. Be careful not to drink unclean water. And hepatitis B and C, which cause chronic liver disease, are mostly transmitted by blood and body fluid transmission. So don't use needles that you're not supposed to. If you find a needle, don't touch it. Don't share razors and toothbrushes. And always think about staying safe. Get vaccinated with hepatitis A and B. The hepatitis B vaccine gives a very long and durable protection. Hepatitis A and a vaccine is available, but the immunity is limited. So children going for exams and people with important commitments and traveling to other places may benefit from vaccination with hepatitis A. And make sure you always eat a very healthy and balanced diet and exercise and stay in shape to avoid fatty liver. Take medicines only prescribed by a doctor, and be careful with tattoos and body piercings, because it can be a source of transmission of hepatitis B and hepatitis C. So the concept should be that not only treat the livers, we have to save the livers even before it starts getting affected or diseased. So if at all you need treatment, mostly it is a medical treatment, because liver starts failing only when it is damaged more than 2/3 of its capacity, more than 70% of the liver damage. That is when you get your first symptom, which may be simple tiredness, or when it progresses, you can have jaundice, you can have fluid in the belly, blood vomiting, kidney dysfunction, and also, like we said, the affection of the consciousness. And in alcohol, the key is to stay abstinent from it and start taking supportive therapy. And if medical treatment fails to improve the patient's condition, definitely the surgical treatment like transplantation is very useful in patients with decompensated liver failure patients, and also for liver tumors, like how Dr. Murli has told. It can be a simple resection, or in patients in whom tumors cannot be resected, you can actually completely remove the entire liver with the tumor and give them the life back to them. There's so much research going on with hepatocyte transplantation, stem cell research, but none of them are yet in a stage where it can be advised in clinic or being available to the patient as of now across the world. So liver transplantation, it is a life-saving operation. There is a need for almost 25,000 operations every year in our country. At any moment in our country, there are almost 10 lakh patients with liver cirrhosis. Not all of them require transplant. Only 25,000 need transplant. But if you see, hardly 2,000 to 2,500 operations that are being done for several reasons. One is because of lack of availability of these facilities and expertise, the cost, which is may not be affordable for everyone, but definitely we are progressing on all these fronts. The availability of liver transplantation is spreading all across the country. Several public sector units are offering transplantation. Insurance companies have started covering transplantation as a treatment. So I am sure in the years to come, these issues will be sorted out. But then the other major issue is about the availability of the organ. So the transplantation is the surgery where patient and doctor is ready, but still you will not be able to proceed. You will need a donor for this treatment to go on. The donor can be either a deceased donor who has been diagnosed with brainstem death. Brainstem death is a complete death. At that stage, his organs can be removed and given to at least 9 patients on a life-saving basis, and several tissues can be removed to treat important diseases in other patients. And if there are no disease donors available and the patient needs an urgent transplant, living donor transplant is definitely a very safe option, because the donors undergo several stages of investigation, at least 3 stages of investigations, and only when they are fit to donate after each stage of investigation they progress, and at the end of it the operation can be carried out safely. And after a liver transplantation, patient live fully well for their entire life. It is not just an operation which is valid for just 5 or 10 years. They will live their entire life in a healthy and normal way. And it is not just an operation which gives their life back. It gives life to the years, rest of his life. The quality of life is as good as a healthy, normal person. And hence, definitely patients with liver failure need to undergo liver transplantation as a treatment. And like we said, deceased donor versus living donor liver transplantation, both of them are an option and safe in the right patient. Deceased donor, the donation rates in our country are very dismal, 0.6 per million when compared to Western world. Like in the best of the country, Spain, they have 35 per million. and living donor safety has been proved by a large experience, and we can be proud that India is one of the countries in the world which are we can call ourselves the leaders in the field of living donor liver transplantation, and a large amount of living donor liver transplantation across the world is done, especially in India. People travel from SAARC nations, Southeast Asian countries, or some nation, even from Europe, people from Russia, everywhere travel to India to undergo liver transplantation, which is more affordable and safe in our country. So this is a picture of a cirrhotic liver, and you can see how after a transplant, the patient gets back to normal life with this kind of a normal liver. We always flush the liver with fluid, reperfuse, and always say a prayer, and the liver starts perfusing and functioning right on the table. So with his permission, I have shared the image of one of our patients 3 months after surgery. He was a passionate biker, and the person was full of life. And he was admitted in a hospital with liver failure, undergone several treatments, and finally, after a successful transplant, 3 months after his life, he's back on track. He's back on his bike to live his life fully. And that is the entire team, the donor in the center. She's also back to living normally, and myself, I had a good time with them, sharing their passion. And I can end by saying that the ABCs of liver wellness would be: A, for avoid diseases of the liver, avoid hepatitis and all other liver diseases like fatty liver disease, know the facts and take the precautions. B, for be careful of what gets into your body, including what you eat, drink, be careful of tattooing, body piercings, and C, consult your doctor for vaccination, testing, and treatment whenever it is required. So, like I said, the liver care unit consists of surgeons with experience, hepatologists who are physicians concentrating only on the treatment of liver diseases, trained nursing staff in the intensive care unit, operation theater, ward, outpatient department, coordinators who will facilitate the evaluation and treatment of these patients with liver failure. And definitely we need the help of multi-specialty doctors round the clock available in the treatment of these patients, and not to forget physical rehabilitation with physiotherapists and dietitians who play an essential part in the recovery of these patients. So my message is: liver health is vital for life. Make healthy lifestyle choices, prevent liver diseases by healthy practices and vaccination, and if at all necessary, very effective treatment is available for liver diseases, and it's a reality. So love your liver, and thank you once again, Hindu, for this opportunity, and also Kauvery management for spreading the message of health and wellness in our community. Thank you.
Thank you, Dr. Ilangoparan. It was a very nice roundup of, you started with the basic function of the liver, and also you proceeded to all the treatment options available in transplantation. Thank you. We have about 15 minutes left. So I will probably have one quick question for each of you.
Not audible. Mr. Ponvasan, you are not audible. Unmute yourself.
Yes, doctor, I have unmuted myself. Can you hear me now? Am I audible?
Yeah.
Yeah. So yeah, we have about 15 minutes left. I'll probably start with one question for each of you, and then we can move on to questions from the audience as well. Dr. Chandrasekhar, you have had more than 3 decades of practice. So you have changed you have seen how things have changed over a period of time as well. So in that capacity, can you tell us how the burden of liver diseases have increased over time? And also, do you see a change in terms of age group on the patients that are getting affected, particularly with liver-related ailments?
I think this is a very good question. 1980, when I passed out MBBS, we did not know anything about B virus, C virus. So we used to diagnose infective hepatitis. There was no data available at all. And then only the hepatitis B was discovered. What we presumed unknown hepatitis, part of it became B virus. And there are certain people were getting infected after the blood transfusion. Take blood transfusion, 3 weeks later, they develop jaundice. We did not know that. So what they have done is they preserved the blood samples of those people. 3 scientists worked on that, and they established C virus. This is one thing. And alcohol was not that rampant. Now it is totally changed. thing. And I used to tell in a lighter sense, those who take alcohol, please raise your hands. Maybe a few people will raise. Now, if I ask the same question, please raise your hands who don't take alcohol. Hardly the reverse has happened. That has really impacted the liver. And the nutritional aspect has improved, the economical aspect has improved. So obesity was seen as a rare incidence. It has become a common, in a pandemic proportion it has come.
Right.
1.3 billion Indians are obese, millions. So what is happening, the liver burden has increased. We have understood more about B virus, C virus. But luckily there is another sea change also happened. We have started screening the blood sample before transfusion. Hepatitis C virus is coming down to some extent, and we have very good treatment for C virus. So we are able to eradicate. And B virus is more notorious, it integrates in the liver, but we have nice, when I started my career, there used to be interferon therapy, very difficult and costly. Costly means unaffordable. Now we have simple antiviral treatment. So to answer the question, the magnitude of the problem has proportionately in certain areas increased, like alcohol liver disease and obesity liver disease. Hepatitis C is taken the third or fourth level. Hepatitis B also. Now another thing happened is fantastic accurate diagnosis is possible. We have lovely treatment for at any stage of the disease. These are the changes happen now.
Right.
And this is what
Right. Thank you, doctor. Thank you. Dr. Murali, I'm posing this question to you because you are practicing at the moment from a tier 3 city. When Dr. Ilan Kumaran was making his presentation, he said that the liver diseases may not show any symptoms unless, you know, 2/3 of its functions are affected or things like that. So in that sense, it may be a silent disease as well. We may not know in the early stage of the disease that, you know, it has been affected. And you are practicing in a city where the awareness may not be much. Many people may not be coming forward themselves for periodic health checks and things like that. So in your experience, what is your experience? I mean, in terms of people turning up with liver diseases, are there many people who are coming at a later stage of the disease? And what would you suggest to the public to look for at an early stage? Are there any signals or symptoms that we can look for at an early stage to get ourselves diagnosed early and also get treated early? Dr. Murali?
Yeah. Am I audible?
Yes.
So I work in Type 3, means I work in Hosur, which is actually a mix of the Hosur city as such. We have a cosmopolitan public means from all walks of life. And we also cater to a radius surrounding consisting of village background. So the cosmopolitan group, they are definitely more aware. They come to the hospital for a regular martial checkup, and we are able to pick up disease at much early stage. In fact, just for alteration in liver function test, means the blood test, we have picked up many findings. And we also do routine screening for hepatitis B and C virus in these patients, and we pick up all those conditions in a very early stage where they are just carriers or where they started manifesting their symptoms, or even when they are asymptomatic. We were able to treat C virus infection in those situations as well. But yes, the surrounding radius of the group of people who are actually having village background, still the awareness is less. We from our hospital, we are conducting this sort of health tracks and awareness talks, wellness talks in this group of people, and we are trying to create awareness. But still, we are yet to find those people coming in an early stage. We still find many patients coming in advanced stage. Particularly, what I find is alcohol. We know means a lot of informations are circulating about alcohol, its ill effects on the liver and things like that. Still, because of the addiction potential and the problem drinking, people stick on to alcohol in spite of doctors advising them not to do that. Most of these patients come to us at a much later stage where we are not able to salvage them medically. These patients will end up with a full-blown decompensated cirrhosis, and this part of the place is quite rampant. Alcohol-induced liver cirrhosis is pretty rampant, and they all will end up with a decompensated liver cirrhosis, and they will require transplant.
Right. Thank you, doctor. Thank you. We have less than 10 minutes left, so I'll move on to some audience question as well. Dr. Ilankumaran, I mean, expectedly, many of the questions have come related to that have come are related to fatty liver. And you made an interesting observation during your presentation that lean people can also have fatty liver. There could be a common perception that fatty liver will be, I mean, only people who are obese will have fatty liver. So can you talk a little more about that particular symptom? And many people have asked, is that reversible and how can one reverse it? And how can it be diagnosed at an early stage?
Oh, I'm glad you asked that question, sir. This entity called the lean NASH, people having fatty liver and a complication, which is a swelling of the liver as a result of the fatty liver, fat accumulation in the liver, is not restricted to only obese people. It is also being diagnosed in people who are lean and thin, which is called the lean NASH. If you remember, Professor Chandrasekhar showed us the picture where how the pathophysiology of fatty liver happens. It is more like a manifestation of the injuries that happen to your liver. It may be because of a lot of oxidative injury, because of your kind of diet intake, more fried foods and other medicines which may not be suitable to the liver can cause an injury in the liver, which can lead on to fat accumulation and show up as a fatty liver. And if this fatty liver goes unchecked, it leads to the next stage, which is called the steatohepatitis, where the liver starts getting swollen, and it is at this stage where the liver cells start getting affected and fibrosed. And till this stage, it is completely reversible, more with diet and lifestyle modifications. And especially when they are being diagnosed in the second stage, the steatohepatitis stage, they will need medications after consultation with a liver specialist. And but then finally, if they have progressed to cirrhosis, no amount of diet and lifestyle medication can reverse, but they will definitely help. So what is the kind of diet? Most people are interested in what kind of diet would help a person with fatty liver. The concepts are that the caloric intake should be reduced. It should be a low calorie and a high protein diet. People tend to think that alternatives of rice, you start taking chapati, wheat, it reduces your caloric intake. No, rice and wheat have a very little marginal reduction in the amount of calories that you can take. So it essentially has to be a reduction in the amount of calories. If you have been taking 2 cups of rice, make it 1 cup of rice. If you have been taking 4 rotis and chapatis, reduce them to 2 rotis and chapatis. Consult a dietitian or make yourself a counter and make sure that you take the bare minimum essential calories, and you can always increase the amount of proteins, and continue having active aerobic exercises. You going to the gym may not actually help in the reversal of fatty liver, but taking up jogging, swimming, cycling, running, and those are the essential exercises which can actually mobilize the fat stores from the liver and hence help in the reversal of fatty liver. So, and definitely we are all talking about non-alcoholic fatty liver. So even if somebody comes to diagnose fatty liver, the first essential question is, do they have even a social drinking habit? If that is so, they definitely need to stop to improve the fat content of the liver.
Right, doctor. Thank you.
Yeah.
Thank you so much.
Thank you.
Dr. Chandrasekhar, there is one question about bilirubin levels. Actually, there are 3 or 4 questions, so I'll combine them into one. People have asked how to maintain a healthy bilirubin level in the blood. What are the causes of its increase? One person has asked that the person consumes 4 to 5 cups of coffee a day. Will it have an impact on bilirubin level? And another person has said he follows a very healthy diet. He intakes a lot of fruit and other healthy items, but still his bilirubin level appears to be high. So what could be the cause and what can be done
The second
to bring
part
it
is
to a healthy
easy.
level? Yeah.
Taking 4 to 5 cups of coffee will not change the bilirubin level. And it's a totally different mechanism operating. But 4 to 5 cups of coffee may not be suitable for our body for other reason. the reflex and other thing. Number 2 is taking healthy diet is good for liver, but now you should know, or the common man should know, that why the bilirubin levels are high. There are 3 mechanisms. The easiest for them to understand is the block in the bile duct, where the bile is produced from the liver, goes to the intestine through the passage called bile duct. If that is blocked, bilirubin levels will go up. That will not be changed unless you remove the block. The second thing easy to understand is the red blood corpuscles, RBC we say now. They are getting destroyed over a period of 127 days. There are certain hematological disorders or spleen-related disorders that can break the RBC prematurely. Bilirubin is a product of broken RBC, which is not good for the body. It has to be a toxic substance. So it goes to the blood to the liver, it gets modified and get excreted. Okay, this is what happens. So you correct the block, you see that hematological blood-related disorders. Third thing is liver disease can produce high bilirubin because the bilirubin metabolism, where the toxic becomes non-toxic, it becomes defective by birth, some people. Those people have continuously little bit elevated, but nothing dangerous to their life. Diet and other thing will not modify that. There is a specific diagnosis. You can just identify the enzyme which is defective and reassure them. Right. So don't worry about it. If the liver disease means you have to treat the liver disease for the bilirubin to come down. In nutshell, I'll tell you that normally bilirubin is less than 1 milligram.
Right.
It's elevated, then you identify the disease, treat accordingly. Neither coffee nor good fruits and other things is going to modify that.
Okay. Thank you, doctor. Thank you so much. Another quick follow-up question to that. It's not exactly a follow-up, but maybe if you can quickly answer that. Some people have asked about the impact of drugs on liver. A couple of people have asked about the effects of paracetamol, and one person has also asked about the effect of blood thinners on liver. Should they be concerned? Can you quickly answer that question, doctor?
Paracetamol, taking one tablet or once in a week or sometime will not be dangerous to the liver. But paracetamol poisoning is seen very commonly in Western population like London, other places. If you take as a suicidal attempt paracetamol too much, then there can be toxicity to the liver. Taking one tablet or two tablets for a day or two, we also prescribe that also. So that will not produce. Anything taken in excess is dangerous. One.
Right.
Number two, blood thinners. There is a balance maintained in the blood for the clotting mechanism and the bleeding, which is disrupted with by the blood thinners. So we always maintain the blood thinners in such a way, neither bleeding nor there is over clotting. So for that we need to do periodic blood test.
Okay.
Should be under constant medical care. So to avoid blood thinner related bleeding and associated with the liver, you should be in constant medical touch. You observe the prescription and the whatever the recommendation given by the doctor.
Okay.
There are patients who consume the blood thinners without any adjustment or without any recommendation. They come with the bleeding. The liver cannot do anything in that case.
Right. Thank you, doctor. We just have a couple of minutes left, so probably we can take one last question. And since we have not had much chance to discuss in length about transplantation, I'll post this question to Dr. Ilankumaran. Doctor, there are some questions about who can donate liver. One person has asked if they have any genetic disorders, will they be able to donate? And who are the other possible people who can donate liver? In a way, I think they're asking, can everybody be Prometheus? Would you like to answer that question? Yeah.
You put it very nicely. So for liver donation, like I said, while we select patients for liver donation, the essential criteria are that there should be between the age group of 18 to 55. Most experienced centers would take up to 55. In rare instances, maybe a little higher. And compatible blood groups is being given the first preference. People with compatible blood groups. If he is a patient is of a B blood group, O group, or B group, positive, negative does not matter. So they are given the first preference, and if the transplant needs to be done urgently, we can also do between incompatible blood groups with some preparation on the patient. And the third and most important thing is to be medically fit. They undergo 3 stages of investigation. First would be to look at their general health. Second would be to look at the specific points about the liver size, the liver quality, the liver structure, whether it is suitable to undergo the removal of a portion of the liver. And third thing, everything else, the patient, the donor,
Doctor, your voice is breaking.
checks, and when there is no identifiable risk factors for surgery, will the patient be acceptable? Oh, I'm sorry. So only when the donor is identified with no risk factors, they can be accepted. And apart from this, the question was
Doctor, your connection is not
disorders. There is a very broad group, patients with genetic disorders specifically related to liver disease.
Doctor, I think, yeah, we had a problem with Dr. Ilankumara's connection. I think we lost him. So anyway, I think we overshot our time also a little bit. My apologies for not being able to take a lot of questions from from our viewers due to lack of time. Otherwise, I believe all those who joined received a lot of insights from all the 3 senior doctors that we had today. I once again thank you all the 3 doctors for joining us. It was an enlightening discussion. Thank you so much. Thank you. Thank you, Dr. Chandrasekhar. Thank you, Dr. Murali.